first call to the public. Is there anyone here that would like to address the commission?
They're both on the agenda.
Okay. So I'm going to move forward with agenda items. I would ask for a motion to approve the replacement of an assistant prosecutor.
So, support?
Discussion.
Very briefly,
Someone moves.
very briefly, one resigned, and we have a vacancy budgeted for a position to replace and refill.
Okay, and we don't yet, we have a candidate, correct? No, we do not, that's right.
That's up to
We
the
do not
department
yet.
heads, the budgeted expenses for the position, and so the
Okay.
board approves the refilling the position, the department head selects the candidate.
Okay.
Are we fully staffed? I didn't, okay.
Yeah.
Ugh, all right.
We were only one down, now we're two down.
Can I get a roll call vote? Does this require, is this all in favor?
Yep.
All those opposed? Oh, did we vote? I think she just answered your question. Oh, I thought you were done. I'm sorry. I'm sorry.
Yeah, no, I am done. I am.
Okay. So, all in favor?
Aye.
All those opposed? All right, motion's approved. I'm looking for a motion to approve the contract renewal with Combined Public Communications for inmate phone and visitation and authorize the chair to execute the same. So moved.
Support.
Do we have any discussion on that?
So this is the communication device that they use at the jail to allow messages to be sent back and forth, video conferencing, because you don't go into the jail and see people face to face anymore. And so they pay a service for this. And that money that is collected from that goes into a fund, a special fund that provides linens, hygiene, bedding, clothing, and other stuff used for the inmates. So it does provide money back to the jail for its services as part of communication. This is a renewal.
So is that the only, like, so you can't say you want to see the person?
You can't unless you're an attorney.
Oh, okay. I didn't know that.
It changed after that, but it hasn't, it's not related to that now. It's just the preferred way that they're doing it all across the state.
So it's not kind of like it's just a statewide thing? Okay.
No, you don't do it from, you do it there, right?
No,
Using
you
their,
can do it at home.
really?
You don't have to go to the jail to video conference in with someone.
I wish I knew somebody in jail so I could try that. That would be kind of cool, really.
They get like a little iPad thing.
Oh, okay.
Huh,
Interesting.
all right.
All those in favor of the? Aye.
Aye.
All those opposed? Motion passes. I'm looking for a motion to approve the refilling of the part-time youth center position in family court not to exceed 30 hours a week. So moved.
Support.
Any discussion on that?
So this is just the refilling of a position in the youth center, which is in the basement of district court. That is where the juveniles go for some of their classes, support, sometimes schooling related items. There was a typo on my part. She said not to not be limited to 20 hours, and I wrote 20 hours. So it's 30.
Okay. So kind of just a minor fix. Any questions about that? Just no. Okay. All those in favor?
Aye.
All those opposed? All right, motion passes. Looking for a motion to approve the contract as presented from La Casa in an amount not to exceed $54,040 to be paid for the Child Care Fund and to authorize the board chair to execute the agreement. So moved.
Support.
Any discussion on that?
So very briefly, and then I'll turn it over to Allison Morrison, who's here from DHHS. But the La Casa contract for services is provided on it's the circuit court division, family court division of circuit court, which is upstairs in district court. This is where the abuse and neglect cases occur. It has to deal with child protective services, foster care programs, and juvenile justice programs. It's the same price as it was last year, the last couple of years. It's a standard service that we provide. If you'd like to say a few words to the commission.
Thank you.
Good evening, afternoon. I'm Allison Morrison. I'm the County Director at Shiawassee DHHS. Here to give you my annual update on the La Casa contract. It is a supportive parent mentor that works with our children who've been removed from their biological parents and placed in foster care. The goal is to create a continuum of family-like support, a parenting, mentoring to the biological families that are working with a parenting coach in a supportive visitation setting as family-like as possible, and that's where the service begins. It's a two-tiered service. It starts with supporting and supervising some visitations for families to work towards children coming back home. And then during the course of that, it can also be referred for an in-home parent coach / mentor who works with the families on basic needs such as setting up medical appointments, seeing pediatricians. It could be school resources in terms of getting them into early Head Start. It could be a variety of things, housing, transportation, basic house cleaning. A lot of our families may lack in that area in terms of keeping standards that are safe for kids. So this contract has been very beneficial over a number of years, and we service anywhere from 20 to a high of 35 children under this contract. And I will just say for the record, it's been underutilized because of staffing challenges in terms of being able to locate and keep staff through the contractor. Our last contractor actually adopted a child and was also doing this as part-time employment, so essentially that took up her time, so we were faced with having to fill the position. So you might see it underspent, and that is why. So again, it's always been a service that the court has appreciated, and we've always received positive feedback from the judges, from court administrator in terms of having this service and helping families rather than just saying, here's your child, you have an hour. We're actually helping, coaching, and mentoring. So.
I just have a quick question about that amount. You had said that maybe not all of it was used. Is it, and you may have said this, and I apologize if I missed it, but is that typical that it's not, the full amount's not used?
It's not been typical.
Okay.
The last couple of years have been more challenging in terms of getting and keeping staff, much like many of our social service partners. But no, it actually, we had increased it a few years back because of demand. And just a note, this is 50% reimbursable to the county. State pays first, and then you receive 50% reimbursement. So.
And what is not spent is not used.
Right.
So it's a maximum of $54,000 from the child care fund, but if we do not use all of those services, say we only use $30,000 worth, then that's all we're billed for.
Okay. Very nice.
I have a question. Allison, so what background does the person have? I know you said staffing challenges. So are we talking social worker? What are we?
It was a master's level social worker, and then due to lack of responses, because of it's really not a high paying position and it's not full time, we did reduce it to a BSW under the supervision of a master's degree person. So that is the educational criteria.
So you can set that, or?
Yeah, I created this.
Okay.
This contract was developed by DHHS as a what's called in-home service component for the county, and so things shifted. I mean, I've been around too long. Okay, so we started out where we were able to draft these, and then it changed and went to some more oversight from the state and then commissioners, of course.
Yeah, because I really feel like if you found the right person, that you really wouldn't need to have I could go show somebody how to do that kind of stuff.
We actually had a parent aide that had a high school education at one point, and she was fantastic, and she did the service for years.
Exactly.
And
That's
yeah. So it really would depend upon the individual, and we could evaluate that because experience can go a long way.
And some empathy along with that.
Right.
And a good mom voice.
Yes.
I would just finally note that this is a request from probate court division of the system. So that's where the family court is ran. So Sarah had to fill out this form to be on it.
Right. It is all under the county child care fund, which is all under the court.
Yep.
Thank you. Any other questions about that?
No.
All those in favor?
Aye.
All those opposed? All right, motion passes. I have one more here. I need a motion to move that we approve the refilling of a support caseworker in the front of the court and a deputy clerk in district court.
So moved.
Or
Any discussion?
due to two employee terminations, there are now two vacancies, and they are budgeted for positions. One, the friend of the court position is reimbursed at 66% by the state, and the other one is a district court position. That person vacated the position 3 or 4 months ago, and they tried to make it work without refilling that position, and they just did it because they're already down a couple other staff members. So it has been a budget savings in between.
So was the recent one, the one you said happened a while ago, that was the grade 3, right? The new one's grade 4, or was it, I was,
Yes.
okay, yeah, that's it, okay.
District court's the grade 3, district our clerk, and the friend of the court is grade 4.
4, okay. Any other questions about that?
Doing well without or not. They tried to make it work, and it was too tight.
No questions. No questions, all right. All those in favor?
Aye.
All those opposed? All right, motion passes. And we are at the last call to the public. Anyone here that would like to address the commission? Okay, looks like we're good. The Public Safety and Courts Committee meeting is adjourned. Thank you.
To order, and if we could stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First call to the public for Health and Human Services. Seeing no one, we will go right into our first agenda item, which will be a presentation, Shiawassee Council on Aging.
So just before we begin, as part of the contract, SCOA presents their budget. You do not vote on it, you don't have to approve it, it's part of the discussion. Questions are always welcome, and she has some things here that I'm going to pass down for you, but there's no action that has to be taken.
So I did have on the second page our budget that our board approved last month for next year. So I'll get started if you'd like. I'm Cynthia, for those that don't know who I am, but I'm the executive director for the Shiawassee Council on Aging. We serve the seniors here in Shiawassee County and their families. We provide services based on grants that we receive from Valley Area Agency on Aging, who is the regional grant provider for the state and federal funds. And we have the largest contracts with them. So the money that we receive from the senior tax millage goes to be part of the match that we need for Valley Area Agency on Aging's grants. And so 66% of our budget is the tax millage dollars. So we do have home delivered meals, which is growing. They cut our funding, and if anybody's been watching the national, the budget, they flat-lined all the funding for the OAA services, which is the, it's the aging adult programs. So unfortunately, there's no increases. They decreased our amount because last year they took money away from us after they gave it to us, and when the budget was finalized, they had to take money back. So they were very conservative this year on how much grant funding they gave us. And so my concern is that we had 131 people on our wait list. And I did go to my board of directors and explain to them that there are ways that we can work with this, and that is by offering people to do a private pay. So if they're before they can get onto the grant program, if they do need a meal, we can still serve it to them and deliver it. But it would be $8 a meal, and that's what our cost is to provide a meal and have it delivered to somebody. So they're getting the nutritious meal with milk, fruit, vegetable, protein, bread, all the nutritious ingredients that we're supposed to have based on the plate formula with the government. And we haven't put that in place yet. That is something where the documents are being put together right now, but the board did approve that we could move forward with that to make sure that people are still getting fed and they're not falling through the cracks. So we're hoping that between now and the end of September that DAAA will magically drop some money on us. That sometimes happens where we overspend our units and then they have people in our region that don't use it all, and so they give it to somebody that can use those units. But I don't see that happening with the meal program because it's been cut so drastically everywhere. So, but we, not only do we do the Meals on Wheels, we do congregate meals, which are people that come into our senior centers to eat Monday through Friday. We have 3 senior centers, one in Owasso, Durand, and Morris. We have personal care, homemaking, and respite. And we were given the approval by Valley Area Agency on Aging to go ahead and work the people on the wait list into our program to get them off the wait list. So they're giving us some more money here to provide the services for those people. So we're working on that at this point. So, but anybody have any questions so far in regards to that?
Actually, yes.
Okay.
So here we have, so the program expenses of $432.78. That's your proposed budget, but then it looks like over here, so that's not just meals, right? That's all programs?
The
432,000 program expenses?
That's program. That's all the programs.
All programs.
Yeah.
So what would you say, what portion of that goes towards meals? Just approximately half, 60%, or?
Well, right now, so we have 200,000 that's coming in for income.
Mhm.
So I would say it's going to be more like 350. By the time you're done with all the meals and the delivery costs.
Okay, so are you covering your costs then?
Yes, we are. Thankfully, we have been able to do that. I haven't had to lay off anybody. We have 38 employees.
38? I would not have thought that. So what portion of those 38 employees are doing meals?
So I have 4 people that deliver meals out of Durand, and I have 3 people out of Owasso that deliver meals. And then we have full kitchen staff in Durand and a full kitchen staff in Owasso. So they both do home delivered meal program plus the congregate meals. And then our congregate meals for Morris come out of the Owasso Senior Center, and they come all prepared, and we just deliver them to the Morris Senior Center on Monday, Wednesday, and Friday.
Okay, so in your congregate meals, 48,000. So
Right.
you're serving a lot less people.
You do, because,
Okay.
we got 300 people on the home delivered meals, and congregate just means whoever decides to come in and eat lunch that day.
Right.
And so we get most people between the Owasso and the Durand Center, we get more people that come into those places to eat, Morris, we're getting like maybe 15 people at the most that usually comes in to eat lunch there, the 3 days a week. So, but you know, again, it depends on what the program is. If there's a bingo that day and they all want to come in and play bingo, if it's meatloaf day, you're gonna see close to 80 people in Wasso.
Oh, God. I hope I never look forward to meatloaf day. Oh.
They do like the meat and potato meals because, you know, you think about it, if they're all by themselves at home, they can throw a can of soup in and they can throw, you know, a frozen dinner in, but when you get to go and have it made and it's nice and hot, they eat with their friends too.
Oh,
Yeah, it's the
see
social.
Great value in that.
Yeah, social isolation is the biggest concern when they start cutting these services and programs that people are just they're not gonna have somebody there to help them, so.
No, my dad's 87 years old and he goes into Twilligers every day.
Okay.
At about 20 minutes after 2, and there's a bunch of old guys. And he has a beer and a shot, and
That's his hangout, isn't
that
it?
is, it's very important to him, yes.
Yeah.
Yeah, I don't know about meatloaf, but.
No. Obviously not at Twilligers probably. But
So,
we've been a safety check for people too, so it's not just about the meal, but we've been able to save people's lives by, you know, they fall over the weekend and they can't get up and they don't have a phone with them, and then Monday morning comes and they know that somebody's going to be there to deliver a meal, and we've found people that have fallen either overnight or over the weekend. And so unfortunately, a lot of them, when they fall over the weekend and they haven't had anything all weekend, depending on when they fall, they can be in pretty critical condition by the time they get to the hospital, because of everything between medications and no food and no liquids and all of that. So, but we are very thankful for our drivers that they have a lot of compassion. I had one driver that was ready to break down a door because he could hear the lady screaming in there, you know, and he was worried about her. It was like his first couple days of work. And so, you know, those things happen. And, but we're able to work, you know, we call public safety and they come and do a welfare check. And then we also call the emergency contact to come in and see the client or open up the door if it's locked or something in regards to that. So we like to have somebody close by, like a neighbor or somebody that's in the area. Mm-hmm. Sometimes you get family that's out of state, and if they list the family that's out of state, they can't get into the house from out of state. So we try to make sure we have a local contact, emergency contact.
so you said 131 people on the wait list. How did you say how many? Maybe I missed it. How many meals you're?
We do at least one meal 5 days a week, based on their person-centered plan. If they need more meals than that, then it's based on their needs. So if they need a hot meal at noon and a cold meal at night, they can get that, as well as liquid supplements.
And you can't bill like Medicaid for that?
That is a different billing. And so what we do is we ask people when a referral comes in if they qualify for Medicaid, or if they think that their income might be below poverty. We are able to refer them over to Valley, and then they can see if they qualify for Medicaid, and they can get on a waiver, which means that they would receive all the benefits that they would receive at a nursing home, but in their own home when you are on a waiver program through Medicaid for adults. And sometimes all they need is the food, sometimes they need the care in the home as well as the food. So, but that's a different billing, and we do cater to those clients as well. We also are part of the PACE program that's here in Shiawassee County. So we have PACE clients that go to Saginaw, and they get, what PACE does is they're like a central hub for all the services to take care of that person. It's like a wraparound. So they see all the doctors that PACE has in place. They do any physical therapy there. They do all their activities there. But then they go home at night to their home. We have some clients that are receiving meals that also receive PACE services, and we get a contract through them to pay for those meals. So.
All right, one last thing. So how many meals do you do on average, like in a day or a week?
Okay, so you're looking every month for home delivered meals. We're doing at least 5,000 meals a month.
5,000
Yeah.
for home delivery.
Yes, and over 1,300, around 1,300 for congregate meals. So what we're doing is, as people come off the program, we're putting people on the program and getting them off the wait list. So,
Okay.
yeah. So we're.
6,300.
Yeah. Yeah, when I combine and do my whole report for the end of the year, it's usually over 76,000 meals total for everything that we do, because we have to add everybody in regardless of their status. It goes to the state. Yeah.
Now, something that we were told by the VA last month,
Mm-hmm.
people that are getting the congregate meals or whatever are not included in the waiting or the home delivered meals. And those that are on a list are getting the meals at no charge. Is that correct? And the ones that are not on the list have to pay the $8 a meal or something?
The people that are on the waiting list, if they want to pay for a meal to get off that waiting list and get some food going, because a lot of times people are willing to pay if they can get the meal, and that way we can take them off the waiting list. And then when the grant funds become available, if they could only do the meals temporarily for $8 a meal, we can put them on the grant funded program at that point. And then we ask a suggested $3 donation. Donations are down. We ask for suggested donations for all of our services, and donations are down. People can't eat for $8, a whole nice meal for $8. But we only ask them to pay $3 if they can, and it's getting harder to get the money from people.
And so is that $3? Because if I take the 209 of income and the 48 and divide that by the 75,600, it comes out to $3.41 a meal. So like, is that kind of your number then, the $3?
No, the $3 is set by the board of directors as regards to how much we charge as a suggested donation.
Okay, so they don't use any actual data for that? They
No,
just-
we don't keep track of who gives those donations. We keep track of how much comes in from every driver, but we are not actually, tracking if that person gave
Well, no,
us.
I was just trying to figure out how much you're receiving for each meal. That's what I meant.
Oh,
Are they
okay.
using that kind of data?
Yeah, when I looked at it the last time, I took our food cost, all of our costs, and what we were getting in. We were not even making $1 when it comes to it just depends on when those donations come in. So more people might give donations more at Christmas time than they do at the beginning of the year. So it's a matter of when that flow of money comes in, depending on if I'm looking at the budget and how much we spent versus how much.
Okay, yeah, I didn't even add in donation.
Yeah, so, and then our in-home service, we ask for $8 donation, and we have a hard time getting $8 out of people for in-home service. And a lot of people are getting paid $30 an hour to do in-home service as direct care workers. And so trying to get people to donate so that we can diversify where our funds are coming from and be able to support things when we have a waiting list, so that we can get more people on. The more donations that we get, we can do that. But yeah,
I don't wanna hog all the questions here. All right,
I've been on the board for probably 10 years or more, so
yeah, I was just trying to go through these numbers. I'll have to look at them.
they're
some
doing
more.
the best they can.
this, those numbers are generalized as far as taking all the programs and I was trying to make a short synopsis of the whole budget versus trying to give you every line item that I have, so. If you have more questions, I'd be happy to answer them. It's no problem.
All right, well, it appears we have no further questions at this time, so thank you.
You're welcome. Thank you.
Did you send out an email to all the commissioners on the meeting for tomorrow at noon?
It's not a commissioner, it's tomorrow at noon, what's the noon?
For the, building,
Oh, that's at 12:30 and that's not a commissioner related, agenda. That's, our building committee is meeting tomorrow, to discuss our Morris building, so. They don't pay for our building, so, yeah. No,
Thank you.
you're welcome.
All right, moving on to our second agenda item. I would look for a motion to approve the contract renewal with the Shiawassee Regional Education Service District for hearing and vision screening for an amount not to exceed $16,219 and authorize the board chair to execute that contract.
I'll make the motion.
I will support that, and I see do we have Larry? Yep, there we
It's
go.
just our contract renewal with the RSD for the preschool hearing and vision screening, 3% increase over last year, so that was good. So that's a contract where they actually pay us to do the services, and that's for the preschool kids.
Okay, so you raised it 3%. Should have raised it more. Look at the
About it.
level.
I mean, there's that price point, you know.
We can afford it, right?
How do they come up with those odd numbers?
It started, I think it started somewhere 10 grand years ago. We've been doing it for a long time, so over the years it's moved up by the rate of inflation typically.
Oh, okay.
All right, any questions on that for Larry? If not, all those in favor signify by saying aye.
Aye.
All those opposed, the same. Good on that. I would look for a motion to approve the contract renewal with Convenient Urgent Care for sexually transmitted infection services and authorize the board chair to execute that contract. Well, I don't know. Greg, or, sorry, Greg. Josh, Gary, would you like to support that?
I'll support, yes.
All right, moved and supported.
Just a contract renewal with Convenient Urgent Care for the walk-in referrals for STIs, STDs. Same rate as last year, so that's good. And that is, it's funded by the state. And then they go there for, we do the initial assessment, but then they go there for the clinical checkup. And then the antibiotics are provided by the health department.
Is there a number associated on that as well?
That's $60 per visit to community care. Just has that number in place for a while. I'm surprised
That
they
seems,
raised it.
yeah, I was gonna say, I don't know what's
I didn't-
involved in that.
I didn't
number,
ask.
but- Right?
It's been pretty static the last several years.
Yeah.
It's stayed at that price.
So they only get paid if somebody goes in and
Yeah,
checks.
correct. And it's an important one. We want to make sure that we take care of it.
All right, any questions on that grisly topic? No? All right, all those in favor of moving this forward signify by saying aye.
Aye.
All those opposed, the same. Thank you, Larry. And seeing no public, we are adjourned. Thank you.